And with that, we'll go into the policy briefing today. Arthur Pang was unable to be on the call, but he did send me as someone to report on his behalf. Today we'll start in Pennsylvania and work our way up to federal level issues. In PA health news, the case numbers have seen renewed growth even as weekly deaths fall. In economic news, Governor Wolf has asked the Pennsylvania Department of Community and Economic Development to defer business loans an additional 3 months for select agencies, including PIDA, PMBDA, and CFA. In Allegheny County, the graph below shows that cases are on the rise, with 300 new cases since last week and 15 more deaths. 90 cases alone were reported this Saturday, which are numbers we haven't seen since April. On Saturday, global confirmed cases topped 10 million, with more than 20% occurring in the United States. In both exhibits, we see that nationwide, there are more than 2.5 million cases, and daily new cases reported last week at 30,000 are now at 45,000 as of Sunday. The Trump administration asserts that increased testing, not reopening, has caused a spike in cases. There is also disagreement between the Trump administration and Republican governors on a mandated mask policy and reopening. Reportedly, the Trump administration aides are considering narrowing the mission of the CDC because of recent case increases and reporting. These changes may also include adding more political appointees throughout. Last week, the Trump Justice Department filed a brief asking the US Supreme Court to overturn the Affordable Care Act. 24 million Americans are insured under the ACA, and the case will be argued this fall. Arthur also wanted me to share that the Senate Republicans' police reform bill was rejected last week by Democrats, while the Republican bill was significantly narrower than protesters' demands. The Democrat proposal in the House also lacks more progressive provisions, including defunding the police. And we'll continue to follow this issue. Finally, for the last slide, Arthur asked me that I share with you the latest findings from a team of Harvard-led economists regarding the economic impact of COVID-19. Firstly, PPP did not significantly boost employment for businesses with fewer than 500 employees. Stimulus checks did increase spending, but didn't have the localized stimulative impact because most spending flowed to big retailers like Amazon, Walmart, and grocery stores. As shown in the exhibits, we also see the impact of decreased spending on in-person services by the top 25% of wealthiest Americans. Unlike the 2008 recession, that impacted consumers' purchases of durable goods such as cars, appliances, and furniture, the downturn has largely hit restaurants, hotels, bars, and other establishments, as well as their workers. The findings also showed that the wealthiest 25% of Americans have been responsible for 67% of the total economic decline in spending since January. With the impact to the service economy, wealthier zip codes have lost more revenue than poorer zip codes at a rate of 70% to 30%. Of the economic fall in wealthy neighborhoods, however, low-wage workers employed there have been hit hardest. Simply put, the reduction in spending by the rich has led to job losses amongst the poor. Opening up of states has also not shown significant economic stimulus. In contrast, high-income people are able to work remotely, and because they choose to self-isolate, they aren't restarting the service economy. Ultimately, traditional economic policy tools such as tax cuts and spending increases won't save the unemployed. Scientists who can restore safety and consumers' health confidence will. Until then, extended unemployment benefits and assistance to low-income workers will be needed. If you would like to see the study, please email us and we'll connect you with Arthur Pang for more information. And that's it for the public policy update.